With 150,000 members, National Nurses United, or NNU, is the nation's largest union and professional organization of registered nurses in the United States, and they are criticizing the Senate health care bill that just passed as being deeply flawed and that it grants too much power to the giants of the insurance industry. The union cites what they say are 10 major flaws in the legislation, noting that many of the same problems exist in the House version of the bill. The nurses say the proposed law is unaffordable for many families and that the mandate forcing all those without coverage to buy private insurance has insufficient cost controls on skyrocketing premiums and other insurance costs. They say the bill offers no challenge to insurance company monopolies, severely limiting choice and competition, and the nurses warn of inadequate limits on drug prices. The union says the reform package does nothing to change the basic structure of the current multi-tiered system in which access to care is determined by ability to pay. NNU says there is minimal oversight of insurance denials of care, major loopholes in the reforms that promise bans on exclusion for pre-existing conditions, and no cancellations for sickness, as well as reduced reproductive rights for women as major failings of the legislation. They say the excise tax on comprehensive insurance plans will encourage employers to reduce benefits, shift more costs to employees, promote proliferation of high-deductible plans, and lead to more self-rationing of care and medical bankruptcies. NNU co-president Deborah Berger said, quote, "Desperation to pass a bill, regardless of its flaws, has made the White House and Congress subject to the worst political extortion and new crippling concessions every day. Much of the expanded coverage is based on forced purchase of private insurance without effective controls on industry pricing practices or real competition and gaping loopholes in the insurance reforms."